How to tell normal moles from skin cancer lesions. Imagine noticing a new spot on your skin or a mole that seems to be changing. It can be confusing to tell if it's harmless or something that needs medical attention. Understanding the differences is key to catching skin cancer early. Normal moles, called nevi, are common skin growths made of pigment cells. They usually appear during childhood or adolescence and tend to stay the same over time. These moles are typically uniform in color, which can be brown, tan, or flesh-colored. They are symmetrical, meaning if you draw a line through the middle, both sides look the same. Their borders are smooth and even, not jagged or irregular. Most normal moles do not cause any symptoms and don't require treatment. They are simply part of your skin's natural variation. In contrast, skin cancer lesions, especially melanoma, often show warning signs that set them apart. To help identify these, many doctors recommend using the absidy rule. The first sign is asymmetry. If you draw a line through the mole, the two halves do not match in shape or color. Normal moles are usually symmetrical, so asymmetry can be a red flag. Next is border irregularity. Melanomas often have uneven, scalloped, or blurred edges, while normal moles have smooth, well-defined borders. The third sign is color variation. A suspicious lesion may have multiple shades within it, such as different browns, black, red, white, or even blue. Normal moles tend to have a single, consistent color. The fourth point is diameter. If a mole is larger than about 6 millimeters, roughly the size of a pencil eraser, it warrants attention. However, keep in mind that melanomas can sometimes be smaller than this. The last sign is evolution. Any change in size, shape, color, or texture over time, or new symptoms like bleeding, itching, or crusting, should prompt a visit to a healthcare professional. Normal moles usually stay the same over the years. It's also important to watch for new moles or lesions that appear after age 30. Most normal moles develop during childhood and adolescence. If you notice a new spot later in life, it's a good idea to have it checked. Some moles may be atypical or dysplastic, meaning they have irregular features but are not necessarily cancerous. Still, they should be monitored closely because they can sometimes develop into melanoma. A helpful tip is the ugly duckling sign, which means if a mole looks different from all your others, it needs professional evaluation. Regular self-examinations are vital. Use mirrors or ask someone to help check hard-to-see areas. Taking photos of your moles over time can help you notice subtle changes. If you see any suspicious features or notice a mole changing, don't wait. Consult a healthcare professional promptly. They may perform a biopsy to determine if it's cancerous. Being familiar with these differences can help you assess your skin's health and catch potential issues early. Remember, early detection of melanoma is crucial because it is highly treatable when caught early. Always seek personalized medical advice if you have concerns about any skin lesion. Maintaining healthy skin involves being vigilant and proactive about changes. If you're unsure about a mole or lesion, it's better to get it checked than to ignore it. Your skin is your body's largest organ, and taking care of it means paying attention to what's normal for you and what's not.